This program is proudly brought to you by Daytech PNG Limited and Telecom Limited.
Good evening, viewers. I'm Malcolm Wyra, and welcome to another episode of Infocus. In this session, we feature discussions on the water, sanitation, and hygiene in Papua New Guinea. Joining us for discussions, we have Mr. Edmund Banik, WaSH Project Management Unit, Communications and Promotions Officer at the Department of National Planning and Monitoring, and Ms. Turia Wickham, Coordinator for PNG WaSH Consortium. Thank you for joining us.
Thanks for having us.
Okay. Firstly, Edmund, what is the role of Wash PMU and the National Department of Health in WaSH in the country?
The Wash PMU coordinates WaSH efforts in the country. We have the National WaSH Policy, which was developed under the Department of National Planning, and we are a PMU, a Program Management Unit under the Department of National Planning. So the WaSH, we developed the WaSH policy to address the WaSH situation in the country. So right now, if you look at where PNG sits in terms of ranking in the Pacific region, PNG is ranked last in the Pacific region, and that's 15 countries. So with the development of the national WaSH policy, we are trying to improve on that status in WaSH and improve on that SDG 6 goals.
Now, Edmund, what is the status in terms of WaSH in relation to the WaSH policy in the country?
Thank you. The WaSH PMU developed a WaSH MIS system, which is now in 17 districts. So we have yet to cover the whole districts around the country to give a correct response to that question. But with the JMP, that's a UN monitoring of WaSH system all around the world, 43% of PNG's population have access to water, 43%. And in terms of sanitation, only 15% have access to sanitation services, which is still lacking in the country and what the WaSH policy is trying to address.
Now, Turia, as the coordinator for the PNG WaSH Consortium, how is your organization assisting in the formulation of this policy?
The PNG WaSH Consortium is an alliance of 4 CSOs, or civil society organizations, and basically NGOs. And what we do is in WaSH, water, sanitation, and hygiene, is working to one of our key outcomes is to strengthen the systems currently in water, sanitation, and hygiene, and that's basically working with government to look at how we can strengthen the enabling environment to improve water, sanitation, and hygiene outcomes across the country in the different geographical locations we work in. So the consortium is made up of 4 CSOs. The first one is World Vision. Then you have WaterAid, Plan International working in Bougainville, and Live and Learn works in KVN. So World Vision is in Makam, and WaterAid is here in Pari.
Are there some success stories that you'd like to share for our viewers?
I guess one of the success stories for the consortium is basically working in close partnership with the government. It's important for NGOs and CSOs to recognize the important role the government plays in sustainability of any of the interventions we are embarking on. So, for example, if we are trying to build water systems, for example, a gravity-fed system in a community, or trying to improve the infrastructure or facilities in schools or healthcare facilities, we need to work really closely with the government, and that's currently happening in the different areas that we're working. So, for example, in Pari, WaterAid is working closely with the Motu Koita Assembly to have the kiosks to make sure that Pari village has water that's focusing on sweat equity. So the community actually contributes and actually pays for the water, but at a reduced rate. And then we have other examples, Plan working in Arob and Markham. We have World Vision working there. And one of the success stories is having that strong relationship with the District Development Authority, which is the service implementer at, at the interface between the national and the subnational government. So we have the Markham DDA working really closely and helping to counterfund some of the work that we're doing.
Now, Turia, what are some of the major challenges confronting WaSH services and programs in the country?
There's a whole lot of challenges that currently face effective service delivery of WaSH. And I think one of the key ones is the financing. So having enough money and budget in the recurring budget for our, in the government, especially at the district level, to have enough money to have proper infrastructure in the schools, healthcare facilities, so that there is water services, sanitation services and hygiene awareness at the district level. That's probably one of our biggest challenges currently.
Some of the biggest challenges in the WaSH sector is prioritizing WaSH itself. As Turia mentioned, financing and coordination and leadership from the national level all the way down. One of the approaches the government has taken is capturing WaSH in the MTDP4 to make it a priority of the government.
Edmond Banik, thank you for joining us. We now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching In Focus. Joining us for this session, we have Dr. James Amini, Chief Executive Officer at the Central Provincial Health Authority. Dr. Amini, thank you for joining us.
Thank you for your welcome.
Okay, firstly, Dr. Amini, why is WaSH important, especially in healthcare facilities?
WaSH is very important because in health facilities, and that's where we come in, that in all health facilities, there are two important things that are important for healthcare facility. Number one is power source, and number two, and most importantly, water. And water is important for many reasons. Number one, for personal hygiene, and number two, for to stop cross-infection and ensure that the health facility is always clean.
How does hand hygiene look alike in the healthcare facilities, and what are some of the practices?
Well, when we're talking about we're talking about cross-infection and just basic hand hygiene with running water source, and washing with soap is very important. You don't have to have very expensive equipments to ensure, but with water, it must be a running water. Basically, I think all over the country, 90% of our health facilities, and I also say that for Central Province, probably more than that, most of our health facilities don't have running water.
Now, with the Global Hand Washing Day theme being hand hygiene is within reach, how does that look alike for hand hygiene in healthcare facilities in PNG? Perhaps we'll start with Turia.
Thanks, Malcolm. Just listening to Dr. Mini and the sobering, facts that 90% of our healthcare facilities don't have running water. That's something that we really have to look towards improving, and that's a priority for us who are working in the WaSH sector, whether it be government or partnering with CSOs. So what does that look like in terms of the theme for Global Hand Washing Day? In healthcare facilities, it's basically having adequate supply to clean running water to be able to wash your hands, to be able to wash the equipment that's in the healthcare facility. So having that theme around hand hygiene is within reach at the healthcare facilities. It's just ensuring that our people who go to the healthcare facilities have access to clean running water and soap, very basic necessities to be able to have that hand hygiene within reach.
What do you think are some initiatives that the provincial governments around the country can be embarking on to improve WaSH activities and programs in the region and the country as a whole?
We can't understate the importance of water in health facility, and one of the things that we have to say to the policymakers is, when you are building a new health facility, there must be added on to that a good water supply system. Because I think for so long, and I've been saying it, and we know that 90% of our health facilities around the country are without water. Because we are saying the importance of water, it must be included when they are planning for a health facility, that water source and power source is part and parcel of the building that comes along with it.
Okay. I understand that currently a lot of the WaSH activities, programs and policies are primarily implemented within the Department of National Planning and Monitoring's Project Management Unit, as well as the National Department of Health. However, there are proposals to have a specifically designated authority, perhaps a WaSH authority, to implement WaSH activities around the country. How critical or how important is such an organization that's specifically engaged in implementing WaSH policy?
One of the issues of having it under national planning is to give it prominence, and I think that was what was behind it, because initially it was under Department of Health before. Having said that, how further have we moved on, and or how have we had impact in terms of health and education in the country, in terms of having water being easily reached by the children and mothers and children in the hospital setting? I still think that under national planning, because the funding source and all those things are coming there, that we can get more out of it. But if it comes to the issue of having it as a standalone and giving it some prominence, then I would go along with that. Yeah.
Now, climate change is pretty much posing a huge risk, both environmentally, economically, and in terms of health. How is the WaSH sector as a whole adjusting and adapting to the threat of climate change? Perhaps we'll start with Turea.
Yes, climate change, I think, for us now is one of the biggest factors affecting WaSH in the country. Basically because when you have change in the weather patterns and the protracted droughts that are currently happening across the country, people don't have as easy access to water as they used to. You'll see, you know, the tanks are empty because it's not raining. You just have to look around Port Moresby. It's quite dry. So our focus is basically trying to build the resilience of communities, and what that does is just trying to help communities be able to respond during a drought. So how are they planning for a drought? Are we raising enough awareness around the country? Are we preparing people to plant drought-resistant crops? How to access water when there's no water? So I think for those of us working in the WaSH sector, that's probably a really pertinent issue at the moment, is dealing with climate change and how we can get communities resilient during these tough times when there's very little access to water because of the droughts.
Okay. From the provincial or state level arm of the bureaucracy, what interventions have been undertaken by perhaps, for example, the Central Provincial Authority?
At the moment, we've got several projects going on, and part of it from our provincial health authority, because water is a requirement to our bigger facilities anyway. We are doing the bore water system that's running, and then one of the other NGOs is engaging to try to bring the solar powered, I'm not sure what you call it, the hydro hydrogen, which turns air into water, but basically it takes up a lot of space with solar panels. You have to have 40 solar panels and all those to get minimum fresh water, drinking water. And basically for health institutions which use very expensive equipments, like they have to be using fresh water, not the mineralized water which you get from the bore water system. So sometimes that's the difference between having a bore water system and fresh water from rain and that sort of thing, because it can damage some of the medical equipments that are in place.
It's good you brought up technological innovation that's been currently applied within the WaSH sector. Toria, what innovative solutions have been implemented by the consortium as a whole to better provide WaSH services in the country?
Basically, in terms of innovations, each of the consortium partners has their own interventions within the geographical areas they work in. So, for example, in Makam, they have the gravity-fed systems that they're working on, and these are community-based, so the community comes together to assist with helping to build the dams and building the pipes down to the villages. So because of the access to the mountains and the streams there, the community has come together and they're building those gravity-fed systems so there's easier access to the water for the villages. Also in Pari, WaterAid is exploring the use of kiosks, water kiosks. So because they haven't had water there for a very long time, WaterAid under the consortium has partnered with the Motu Koita Assembly as well, and with funding from the Water for Women Fund through DFAT, they are helping to strengthen the kiosk system so that there is a level of ownership in the community, so that people feel like when they're paying for a service, there's a greater ownership and accountability. And in terms of sustainability, you know, people are looking at actually looking after these infrastructure that we build. So I think in terms of innovations, it's looking at for the consortium, it's building on the strengths within the community, community support, sweat equity, the natural resources that they have, and then using our partnering and partnerships to improve the services there, whether it be through kiosks or gravity-fed systems. So for us, those are the what we are doing in the communities.
Thank you, Turia. We now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching In Focus. Now, Dr. Amini, what is being done in relation to hand hygiene in the provinces? And a case in point would be the central province itself. So can you give us your perspective on that?
As you know, the COVID-19 pandemic brought into the country the deficits and the huge gaps that we have in our health system. And one of them was the simple thing of hand hygiene. As a clinician who has been working for 40 years, more than 40 years, I know that part of what my job is, before I go from a patient to another patient, I have to wash my hands. But that goes out the window when you have a busy clinic and there's plenty of people to. And so it reminds us that we have to wash our hands every now and then. And so our message to all the health facilities is somehow here to wash your hands. If you don't have the hand washing thing, then the hand hygiene solutions that you have to use. But the most cheaper way is having water and soap. And that's very important, paramount. It has to be in all health facilities. We are ensuring that has to be. And then the second step we are going to take is ensure that there is a water source in each of the. So I think for Central Province now, in the last few days, it's been raining a lot. But there was a dry spell and had some difficulty. And so we had to ensure that there were ways of how the facilities can have water and water cottage, and some of those came into play. But that's how important it is, not only for health facilities, but also for education institutions. And I'm saying this especially for a delivering mother. You wouldn't want a mother delivering and lying in a mess. I mean, just think about it as your own mother or your wife, or without any water source. I think we will be found as being inhuman and not being able to meet the needs of our people if we don't meet that the water for the patient. So that's how important it is that we meet those water needs for the health institutions for more reasons than once.
How is the PNG WaSH Consortium working with the government to improve hand hygiene in the provinces?
Thanks, Malcolm. I think for the consortium, we recognize the importance of hand hygiene and working with our local PHAs. And we're really fortunate to have very good working relationships with our PHAs in the areas that we're working in. And one of the gaps that was recognized early on in the partnerships was that whilst there are minimum standards in the National Health Plan, there was a lack of a focus on WaSH, minimum standards for WaSH specifically in healthcare facilities. So as a consortium, one of our key pieces of work was to work alongside the government, the National Department of Health, as well as the PHAs, to develop minimum standards for WaSH in healthcare facilities specifically. So those minimum standards basically, like Dr. Mini was saying, you need minimum standards to guide what you actually, what you need in the healthcare facility. For example, running water, soap as minimum standards. And we're not asking for, big expensive things, just the basic minimum that healthcare facilities need to operate so that our women, children and men, our boo-boos, who are going to the clinics have access to these basic necessities.
How can local community leaders be engaged in promoting and, advocating and providing awareness on WaSH activities within the local communities? Perhaps we'll start with Dr. Ameni.
I think the best way to advocate is in every meeting place or every gathering that you have. There's the hand washing facilities made available, and everybody made to wash it. As long as it becomes part of our everyday living, we will continue to ignore that. And with the pandemic that was switched on, but we can't switch off again. We have to ensure that that's part of our everyday life. Let me give an example. When I went to do part of my master's training in Sydney, I became quite used to washing my hands, and then before I did my investigation, whether it was a lumbar puncture or collect blood, and then when I went down overseas, I washed my hand, and then I was going to do a lumbar puncture, and everybody was looking at me. And then I suddenly realized that I had to gown myself for that simple procedure. It's important that these are part of infection control. And so those simple things are embedded in overseas culture. But because of, I suppose, we are quite busy in PNG, that we only wash our hands and wipe down the area and then do our procedures. But some of that is important that we practice it so that we don't pass on infection from ourselves to the person that we are treating. Things like that. Those are good examples, and as long as we ensure that we practice it every day, it will be part of us. If we don't, then it gets lost along the way. And now if our children see it, they will also do it. So I suggest as a way forward that in every meeting that we have, or every gathering we have, that there's some facility put in place for hand washing so that it becomes part of our culture.
That's a really important entry point, I think, Malcolm, for improving any sort of intervention, and it's having the leadership. And I think for this year's theme on Global Hand Washing Day, it actually looks at leadership in making sure that hand hygiene is within reach. So for actors such as NGOs or civil society organizations partnering with the PHAs is one aspect. Another aspect of our work is actually partnering with local communities and strengthening the leadership in the local communities and their governance structures. So we work very closely with the LLGs. We also work very closely with the community leaders in the specific communities we're working in, and the mechanisms they have, such as local wash committees or community wash committees which are community-based, and they actually, that governance structure is within that community, led by them, so they take ownership of the interventions. And like Dr. Mini said, and rightly so, we need to model that behavior to each other, to our children, to everyone around us, and just having a, soap and water when we're having gatherings or meetings or what have you, and just having that constant, access to water and showing and demonstrating to our younger generation that you need to wash your hands. I think that's one of the best ways we can do in terms of influencing our generations in the communities.
Dr. James Amini and Ms. Turia Wickham, thank you for joining us.
Thank you for having us.
Thank you.
Well, viewers, that's all the time we have for this edition of Infocus. On behalf of the entire Infocus team, thank you for joining us. Good night.
This program was proudly brought to you by Daytech PNG Limited and Telecom Limited.